Welcome to Olympus Talks, the podcast that brings you to the forefront of medical technologies as we explore advancements and innovations in GI. This 8-episode series features talks with healthcare professionals, patients, and Olympus subject matter experts. Listen as they dive into various aspects of GI health, focused on improving patient outcomes through best practices. Stay tuned for conversations designed to educate, inspire, and inform. Brooks Bell is a paid endorser of Olympus Corporation, its subsidiaries, and/or its affiliates. Olympus Corporation of the Americas and its parents, subsidiaries, affiliates, directors, officers, employees, agents, and representatives, collectively Olympus, do not represent to or warrant the accuracy, reliability, or applicability of the content. Under no circumstances shall Olympus be liable for any costs, expenses, losses, claims, liabilities, or other damages, whether direct, indirect, special, incidental, consequential, or otherwise, that may arise from or be incurred in connection with the content or any use thereof. The content of this podcast was paid for by Olympus. The positions and statements made herein are based on the speaker's experiences, thoughts, and opinions, and do not necessarily represent the views or opinions of Olympus. If you are a patient, it is important that you discuss information about your health with your doctor. Hey everyone, this is Tom Salemi. Welcome to the first episode of the Olympus Talks podcast. I'm here with the star of our very first show, one of our co-stars, I should say, Kurt Cannon. Kurt is Vice President of Endoscopy Marketing at the Olympus Corporation of the Americas. Kurt, welcome to show business.
Thank you. Clearly going for the C-list stars here. So thanks, Tom. I appreciate you having me.
No, sir. We signed the Type A stars for the opening episode. So certainly speaks to your drawing power. So you were on this podcast episode with Brooks Bell of Worldclass Clothing. And we talked a lot about one of Olympus's missions, which is helping people get early testing and having colonoscopies done at an earlier age than they might be comfortable. What were some of your takeaways from this conversation with Brooks?
Yeah, I think one of the big takeaways is educating the general community around the importance of colonoscopy in general. Obviously, the screening age has dropped from 50 to 45 in recent years, but the reality that early detection is an important part, and screening is where you get that early detection. As you mentioned, Brooks's story is a great story about early onset colorectal cancer. She wasn't even 40 years old when she was diagnosed, and it was through her family or her advocacy and not really having a family history, but her own advocacy for her health that she was able to get treated and is a survivor today. So that's really one of the big takeaways I think that people will get out of this podcast.
Absolutely. And we, of course, talked about some of Olympus's offerings in this space, and folks can hear all about that. What are some of the before we get into the discussion, just circling back on the importance of testing when you're at a party or a barbecue, and if the topic comes up of testing, what do you do to kind of convince people that it's better to get looked at earlier than later?
So first, colonoscopy should be the topic at every barbecue. Like the first thing you should bring up. So I definitely would recommend it. It breaks the ice. But I think the important thing, especially if you're at a family barbecue, honestly, is this is a family history issue.
Yeah.
People don't traditionally understand their family history for any disease. But with colorectal cancer, it is largely preventable, right, if you get screened early enough. And you just need to know if there's a family history there. So having the conversations is important. And the other component of that, Tom, is your ethnic background actually plays a role in your overall risk. So not only understand your family history, but understand who you are and that ethnic makeup, and understand how that impacts your need to go get screened earlier or more often.
Great. Well, we've covered a lot of that in the episode today, so I don't want to take any further delay. Thank you to you, Kurt, for being on our first episode with Brooks. And, of course, thank you to our corporate partner, Olympus, for making this podcast series possible. And without any further delay, let's start episode 1 of the Olympus Talks podcast. Well, Brooks Bell and Kurt Cannon, welcome to the podcast.
So glad to be
here.
Thanks for having us.
It's going to be an important episode, and I'm really grateful to Olympus for putting us all together to really get this message out to the public. So let's put that important talk off for a moment and just take a few minutes to learn about you both, so our listeners and our viewers know your perspectives and your histories and your stories. Kurt, let's start with you. How did you find your way into the medtech industry?
Well, it's an interesting path, but probably one that many people that start in sales have. I actually have a degree in history. So I went to school, loved history. I needed a degree in order to get into a sales job. So I went to school, got my degree, ended up selling vaccines for 2 years, and then got a phone call that got me into the med tech device space. Was with a competitor of Olympus at this point in time. And that was where the journey started. And I entered and never wanted to leave again. Found my home in GI endoscopy, and that was 25 plus years ago.
What was it about this particular space within this great industry that stuck with you, that resonated?
Well, I was obviously very young. It was my first foray into the space, so I don't know that I ever took a chance to look at something different, but I fell in love with really the physicians, the engagements you have with them, and really learning about how they help patients. And then once you learn that, and then you understand how your company impacts those things, if you've got a great company and you enjoy the physicians you work with, at that point, why leave? And that's really where other than changing companies, I stayed in the same field because I love the field of GI endoscopy.
Excellent. All right. Well, great story. And Brooks, let's unpack your history, what brought you here today, and your company. First, let's start with your company and what's the name, what's the mission, and then I think from there we can work backwards to understand how you got to lead this effort.
Yeah, so I'm the co-founder of Worldclass Clothing, and it's an apparel brand that seeks to change the culture around colonoscopies to make them a little sexy. And it's actually a nonprofit, and all of our net profits go towards reducing barriers for underinsured folks to get their colonoscopy.
That's amazing. So how did you come upon this mission?
Well, I was actually the CEO and founder of a data analytics company that I was running for 16 years. I had started it in my early 20s. And then when I was 38, I had blood in my stool and saw 3 doctors, had to kind of fight to get a colonoscopy, and was diagnosed with colon cancer, age 38. And I left my company actually the day after my diagnosis and handed it off to my president to continue to run, and started to research colon cancer to understand what had happened to me, how could I get it so young, why wasn't it on my radar, and what could I learn from it. And so I became obsessed with colonoscopies actually for the next 6 years, and finding out that how powerful they are in this space. It became my mission to change our culture and help people learn what I learned.
So what from that experience convinced you to redirect yourself in your career to this effort? A lot of people would go through that and just say, "Ooh, bullet dodged. Let's move on with my life." What stuck with you?
I guess I felt like I was in a unique position to be able to have that kind of impact. Having been a CEO of a company, I had leadership skills. I had capital. I had a network that was larger than most. And I don't know, I think that having run my company for 16 years, I was probably ready for a change. And so I took some time off and took care of myself, healed. And I don't know, it was kind of exciting to have a purpose, to have something that made life just a lot more meaningful. Having gone through something so crazy as cancer at a young age, it felt like it was something that could bring me closer to people. We all have colons, we're all at risk, and it was a way I could connect with people in a way that felt meaningful.
So how does a clothing company afford you the opportunity to spread that message? Give us a sense of what you're trying to do through that medium?
with colonoscopies, people are very afraid of them, and then also it's hard for them to get them. So we have both a demand problem and a supply problem. And so thinking about where can I move the needle, I was thinking that really the demand problem is where I can have the greatest impact. And so if I could get people to want a colonoscopy, that felt worthy. Once they want them, then we can work about on making them more available. And so I actually had an early success a couple of years ago where I convinced a celebrity to get a colonoscopy, and it proved out my thesis that if we can increase demand, it will make a difference. And I got Ryan Reynolds to get a colonoscopy, and he actually created a video around it that had 16 million views in the first week. And so after that, I thought, okay, well, thinking about this in a really creative way, and trying out things that haven't been done before really might make a difference. And so apparel, and fashion is very much in the cultural space, setting trends, helping people feel and look cool, and, and also self-expression. These are all very important to us as humans. And cancer is something that people are universally afraid of. And so if you can prevent it, that's very empowering. And that is something that's worth celebrating. And so giving people a way to kind of connect with something that's scary, but not in a way that's also empowering for them is kind of the goal with our apparel brand. It's very simple. It doesn't actually say colon cancer, it doesn't say cancer, it doesn't say colonoscopies on most of our line. It just says world class. And so, and versions of, you can see the hat behind me that has a stylistic version of ass. And that's world class. It's actually short for world class ass. And so, try to activate the energy that is around a colonoscopy, and in a very positive, very joyful way that I think is really resonating with people right now.
That's amazing. Kurt, you've been in the space for a while. Can you talk a bit about the patient population in this space? What is the patient population like that Olympus is dealing with in this particular space?
I think, Tom, it's really interesting to see how things have changed over the past 20 years. I'd say when I started, I don't know that the patient population in general was as educated as it is today. I would consider it a highly educated population of people in every form of medicine at this point, because so much information is available to people these days, right? They can search things themselves and get the facts and find people like Brooks who are also patients and now patient advocates and survivors they can lean into, and they don't have to go to their doctor for all the information to understand everything. So they've got every vehicle available to them. So the patients are more educated, and I think the companies, and I speak specifically to Olympus, being a leader in this space for so long and having developed the first gastro camera 75 years ago this year, you have a big responsibility, and we talk about that a lot here, about what is the responsibility we have, not just to the business, but to the patients, to our physicians who are our customers, to help educate, support, be more involved in the community aspect of things. That's not something that I don't think a lot of companies 20 plus years ago really focused a lot on the community, the education side, the patient side. We just tried to serve the customers we had, the doctors, with product. And how they did that with patients and served their patients was secondary. It's actually very holistic now, which is what I love about the business and how it is transformed, is that I can have a relationship with someone like Brooks where she and I talk about different things and how we can work together. And there are other patient advocacy groups that other parts of our company deal with all the time. So not only is it a more educated group, but they're more engaged, and we as companies have also opened up our arms to be part of that conversation.
Yeah, and how about the physicians? What is their appetite for change, like for technology, for new technology? Are they fast adopters? Are they cautious? Give us a sense of the physicians you're working with.
It's interesting. I was thinking about this a bit when you posed this question. There are some people who would say back, again, 20, 25 years ago, it was like the golden age of endoscopy where all this technology and innovation occurred. And in reality, I would say that this is just another golden age. It's a different generation of physicians, but the desire to innovate and push for new therapeutic treatments, the changes in technology, the physicians we work with, they come in all shapes and sizes in terms of early adoption. But when you get into the academic space and you look at physicians in that space, they are almost all of them looking to lean forward as far as they can and drive innovation with corporate partners when they can, or in many times on their own with startup companies, which again have proliferated over the past probably decade or 15 years, to really kind of supercharge the innovation in the industry. And companies like Olympus have stepped up and done the same thing as we transform our technologies from basic imaging, which is the history of the organization when you look at cameras and microscopes, to how those technologies apply to endoscopes today, which is the only part of Olympus that remains, is the medical side of the business at this point, totally focused. You've got people that are clamoring every day for new innovation, and that innovation is happening, and it's changing the outcomes of patients on a daily, weekly, monthly basis, without a doubt.
And Brooks, let's talk a little more about the patient population. I mean, you mentioned that we all have the one thing in common. We have the colon. I don't know if there's much more than that. Like I said before, if you're not diagnosed with something horrible, I don't know if you assign yourself, a person assigns himself to being someone who would get a colonoscopy, other than it's something that they're planning to do someday. What's the patient population like that you're dealing with, and how do you create something that binds folks together so you have a critical mass of patients who can help you affect change?
I think there's so much fear around getting colonoscopies, and it's because conceptually, the idea is uncomfortable. And recognizing that that's where people are and meeting them where they're at, I think is part of what we're trying to do. I think we're trying to also just focus on the empowerment of a colonoscopy. People don't realize that it very well might prevent a case of colon cancer in them, and start to educate them on why they want to do it. So many, we've been talking about colonoscopies for the last 50 years about all the reasons you don't want to do it. The prep, the idea, we're joking about it, the discomfort, you might feel old, it's just the vulnerability. And we don't talk about the reasons you do want to do it. And we don't talk about polyps, which is the purpose of doing a colonoscopy, is finding out if you have polyps in addition to tumors, in addition to other diseases. But finding polyps is really the reason you want to do it, and they're very common. And so if we start kind of reframing it, and getting people curious about what might be in their body, and also getting to engage with a really amazing technology, maybe some of the most advanced technology someone will ever really engage with. We think about the vulnerability of a scope, but it's actually a pretty amazing what you're doing in there. Having pictures and little snares, and it's all being operated from a distance. It's high def. It's pretty cool if you start to think about it in different ways, and it's clearing you out. It's almost like having a deep colon exfoliation. You wake up feeling skinny, you feel clean. And so I think that if we just think about it in a humorous, funny, positive, and pretty exciting way, I think that will truly save lives.
No, I agree. And I shared prior to pushing record, I've had mine, and it was not a big deal. It was not a big deal at all. And it was actually, the prep was even, I remember I kept reading the instructions because I'm like, am I doing this right? Because I'm not miserable at all. Like I must be missing a step, because it really was easy to do. And you're right. I dropped a few pounds after that and kept them off for a time. I think I need to go back and do another.
Yeah, and the nap. We don't even talk about how great that nap is.
So, Brooks, what can industry do? Kurt mentioned he talks to you once a month. I'm sure you're engaged with others in industry. What can industry do to help you get the word out? Because obviously it helps everybody. It helps patients. It helps physicians, and it helps medtech companies. If more people are, as you say, if the demand goes up for these procedures.
Yeah. I think Olympus and physicians are in a position to help, not just help patients kind of know what to expect, but also help them make informed decisions about getting a high quality colonoscopy. This is an advanced procedure for many of them. It's maybe the first time they've been in a gown, maybe the first time they've been put under, and they're afraid of it, and they want to make sure they're getting the best colonoscopy that they could. And it's important because the better you are at catching polyps and taking them out, the more likely it is that you will be protected in the future from cancer. And so we have these quality measures like adenoma detection rate and other measures that most doctors that they track on their own behalf. And I think helping patients be aware of them and asking about them, also asking about kind of investment in technology. How new is the equipment? Like, what are the features? Just knowing that the doctor, the physicians are investing in patient care and technology to make it easier for them to find as many polyps as possible and make it as comfortable as possible. I think those are things that doctors should get more comfortable talking about and for patients to start to ask about. Because I think if the more confident they feel in this procedure, the more willing they'll be able to do it.
So, Kurt, you have a lot of input from Brooks and patients, and you're obviously engaged with physicians a lot. Talk a bit about how you're taking that input and how it's translated into Olympus's offerings in this space. And maybe this is a chance for you just to share a bit about your portfolio in this area.
Sure. I think what's unique about Olympus and what we try to talk about a lot and remind even ourselves is how comprehensive our portfolio is. Again, as a pure med tech company now whose largest division is GI endoscopy, we run the portfolio from the endoscope and imaging all the way through the devices, cleaning and disinfection of those devices so they can get back to the next patient, all of that under our umbrella. So I think the center of it, and the thing we have to always focus on, especially Brooks mentioned ADR, adenoma detection rate, everything starts with the processing platform. So we just launched our EVIS X1 endoscopy system a little over a year ago, and that's our latest technology. And it's a processing platform that processes the images and utilizes different imaging technologies to help identify lesions as well, to help the physicians. But the scope has to plug into that. And over the years and generations of endoscopes, you see them getting smaller with larger working channels, they call it, inside the scope. We focus heavily on the ergonomics of those scopes. If you think about a physician who does screening colonoscopy, they might do 15 to 20 screening colonoscopies a day. That's a lot of repetitive motion. So it's one thing to focus a product on the needs of ultimately the patient and how the physician treats the patient. You also have to treat the physician and make sure that they can continue to perform at the highest possible standard. And there's a lot of different ways that we have to think about the product as well. So when you think of endoscopes, the ergonomics of it, the size of the channels allows it to be more comfortable for the patient, but also allows the physician to insert more therapeutic devices down to retrieve the polyps, as Brooks mentioned. And those are critical. You send those off to pathology to determine whether there is or isn't something more serious that needs to be treated. So there's a lot of factors that have to go into the design of an endoscope, and you get a lot of that feedback from your physicians. But you also can garner a lot of that from listening to a patient and a survivor and their stories as well. So when you look at that part of our portfolio, I think it's critical that we continue to evolve the imaging technologies to help the physicians and also the ergonomics around the endoscope. So then you look at the second part of our portfolio is the devices that go down the scope to retrieve the pathology that you need and to treat. So that could be, again, a snare, a forceps, it's a needle sometimes to inject. It's sometimes a knife to cut actually things out of the patient, right? Pathology out of the patient, which is a very common procedure these days called ESD or EMR. So all of those technologies again, come from these interactions with physicians who are trying to be more minimally invasive with how they treat. So endoscopy, endoscopists, and endoscopes are a growing way to treat patients and get them back home with their families the same day. And then the last component of that I mentioned is, the cleaning and disinfection. Obviously, a huge component of this is how do you use an endoscope and then reuse it again? And it is one of the key pillars of our organization is understanding that, making the machines that do it, and trying to lead from the technological standpoint.
I'm coming at this from a position that it seems like this has been a something that folks have known they need to do for a long time, and you're doing a great job of raising awareness and of letting people know that these tests they should be screened sooner, and they should certainly be screened. But what's something that folks need to know that might really drive that point home? Is there a change in the dynamics of colon cancer? Is there some new thing that folks should be aware of that you think would really kind of grab their attention and lead them to getting a screening done?
Yeah, Tom, I think it's critical for people to understand that the screening age used to be 50. Mm-hmm. And several years ago, that was changed to 45. What's actually the scariest thing that's been occurring, and I think most important for people to know, is that according to the Colorectal Cancer Alliance, 10% of colon cancer cases are diagnosed in people under 50, and that is rising at about 1% to 2% per year. So the fastest growing group of diagnosed patients is likely under the screening age. Mm-hmm. And ultimately, that story and that trend is what led us to Brooks and to meet her, because that's her story. And it's a very powerful story to tell, and the way she tells it is tremendous. And that's why we continue to work with her to try and find avenues for her to tell her story, because people need to hear it, and they might not always listen to me or even to their physician, and they might kind of slough off what they see in the news. It's kind of hard to ignore another human being giving you their personal story, and especially when they become more common.
Well, Brooke, let's unpack that, because 10% is a scary number given to Kirst's point. I mean, the vast majority of people getting screened are going to be over 50. So if 10% are under 50, I think the sample size of that is pretty small. So what is that? Talk a bit about that scary element and how are you getting that message to the people who need to hear it?
According to American Cancer Society, 1 in 260 people get colon cancer before they're 50. And it's about 1 in 23, 1 in 24 in their lifetime. When you think about that, that's like, I don't know, 1 in 23, 1 in 24, that's like, maybe the number of people that's on a city bus with you. I mean, you're frequently in groups of 23 or 24, and one of you is going to get colon cancer in your lifetime. And even, large companies, if you're part of a 1,000-person company and you're, 40 years old, 4 of you are going to get colon cancer in that company, and statistically. And so it's becoming a pretty big deal. And what's also scary is we don't know why. A lot of the people who are getting diagnosed at a young age, they're not overweight, they are healthy, they exercise, they just don't fit kind of the risk profiles that you might expect. And so physicians are looking at a lot of other, or scientists are looking at other environmental factors, but they really just they don't have a really solid smoking gun or a lead that is really explaining this narrative. And so if you can't really with lifestyle, be sure that you're going to be protected from a top cancer. Fortunately, we do have a procedure that can swoop in and really help reduce those risks. So I think that's why a colonoscopy is so important, is that we feel kind of helpless just using lifestyle. I exercise, I eat salad for every lunch, and still I got it. And so what am I supposed to do? And I think that's what I'm hearing about all the time, is that people are getting it, shouldn't be getting it.
And I have to think it's not a binary thing. That it's not a matter of having it or not having it, or detecting it or not detecting it. The earlier you detect it, obviously, with any cancer, the better. Talk a bit about the importance of getting it early. If you detect it late, I imagine.
Well,
There may be cases where you can't do anything.
yeah, I mean, colon cancer caused by polyps, and we don't know when people are starting to grow their polyps, and we don't know why. And so a lot of more research needs to be done, but we do know that a polyp is a precursor to colon cancer. And they don't have symptoms. There really is no way to find out if you have a polyp, especially a small one, without getting a colonoscopy. I had 3 polyps when I had my first colonoscopy at age 38. One was already a tumor. And so it was too late, for me to prevent it. But those polyps were probably growing in me for years beforehand. And so I think that's the conversation, is actually around polyps. How do we start talking about the existence of polyps, kind of the nature of them, and getting people curious about whether or not they have polyps? Unfortunately, even if they're curious, they can't do much about it until 45, when their insurance pays for it, unless, they've got a couple grand sitting around that they just want to blow on a colonoscopy. Out of curiosity. Personally, I'd rather buy a handbag than a colonoscopy if I'm most people and have extra couple grand. But still, we have to start somewhere, and getting people curious about their body and whether or not they have polyps. At least then they will be much more motivated to immediately get their colonoscopy scheduled at their 45th birthday. Today, they're waiting years on average to get their first colonoscopy. Why? Probably anxiety and the fact that they don't know why they should get it in the first place. And a lot of cancer is happening from between when people turn 45 to when they finally get their first colonoscopy, which is usually in their early 50s.
Wow. All right. And I'll underline here again. It's not a big deal, folks. You don't need to wait.
Not a big deal.
It's not a big deal.
The way I talk about it, it's a fast, a cleanse, and a nap.
Yep.
And
Absolutely.
a day off, you feel great.
If I could mention one other thing, and it's the importance of understanding your family history. That's the other big educational shift here is, regardless of who you are and what your background is, people need to start becoming comfortable with asking the questions of their parents and their grandparents, but quite honestly, their parents. And that's not something that most families are comfortable talking about. It's the one thing no one wants to talk about. What happened to mom? What happened to dad? What happened to grandma and grandpa? No one knows. We have to start having those hard conversations because if you understand that you have a family history, you can get screened early. Right? That gives you the opening to go and do that, and that saves lives.
Having large polyps is actually family history. And so having a conversation with your parents, not just about whether or not they had colon cancer, but whether or not they have a history of polyps or a history of a large polyp, that is just as powerful. And they should find that out and then tell their physicians if that is true and they do have a family history of polyps and large polyps.
And Kurt, I don't know what is the chicken or what is the egg in terms of getting people to test earlier and getting people covered for earlier tests, and just, is this something that industry needs to create a clinical case around, and is that something you're doing? Do you begin trying to get folks who are younger to go through a trial and to get tests and to show what can be detected earlier? What's the next step, and how do you encourage folks to get screened?
I think it comes back to really the change in how corporations like Olympus and many others in this industry have opened themselves up to being part of the global conversation and not just working with physicians. Physicians do a tremendous job in running studies of their own to create clinical data that would say that you need to get screened at this age or that age. But the responsibility we have is to continue openly to having these conversations right here that would get out to tens of thousands of people to talk about, have you had a family discussion about this? Do you know why that's important? Did you know that this many people have early onset colorectal cancer and it's completely preventable if you get it early? Those are all things that they sound so simple, right? Here we sit talking about it. It sounds very logical, but there's this kind of wall that I see that exists between the people that live in the industry or like Brooks have experienced it and then everyone else in the world. And those are the avenues we're going to use to get there are podcasts like this, right? Blog posts, the non-traditional media outlets that are going to continue to have the conversations and push the narratives out to the general public, so that they start to understand that there are significant needs in their health earlier than most people would imagine. Because if I'm a standard example, when I was in my 30s, nothing was going to touch me, right? I'm young, I'm healthy, I've got a young family, of course. I don't have anything to worry about for another 10 or 15 years. That's just not the case. And everybody knows it, but nobody wants to talk about it. So like many things, we just have to drive the conversation and be willing to push into an uncomfortable space, which you go back to what Brooks and I talk about this all the time. What I love about her messaging is it's trying to make something very uncomfortable fun. Talking about a colonoscopy, who's doing that? More and more people than you would think, actually, these days. Right? I mean, if you saw there was a Super Bowl commercial where they referenced a colonoscopy. I won't talk about the brand, but they actually said, "I can't do this. I got a colonoscopy."
Yeah. It's getting out there, and of course, I did see the Ryan Reynolds video, so great job with that. We'll wrap up with just a few, just 30 seconds, Brooke. What's the message? What's the message that you want folks to walk away from at the very end of this podcast?
I just want people to know that many believe that colonoscopies prevent colon cancer, and that it's a cancer worth preventing. They can get more information about what I'm doing at worldclassclothing.com. They can purchase anything there. They can also donate to the foundation, where all the net profits go to paying for reducing barriers for colonoscopies in underinsured communities, where it's not just awareness, it is many other barriers that keep them from getting screened. And so that's something that they can do in addition. And then also they can go, and of course talk to their doctors about family history and finding out if they personally have polyps.
Great. Kurt, last 30 seconds to you. What message should people walk away with?
First one would be, don't ignore the obvious. Don't ignore your body. If you have blood in your stool, that's not normal. So you have to start investigating that. You have to ask questions. You have to be your own advocate. That's probably the great takeaway. Advocate for yourself. Push. If you don't get the answer you want, find another doctor. Keep pushing, because something's not right. Hopefully it's just a hemorrhoid. Great. Then off you go. Those are easy, right, comparatively. But there's the flip side of that. It could be something much worse, and too many people just ignore those things and move on. So that would be the one thing. And I think the second thing is a message that has to come out of this is understand that ethnicity does play a role in your risk profile. According to the Colorectal Cancer Alliance, Black Americans, it's the second highest mortality rate and incidence rates of colorectal cancer in America. They are 35% more likely to die from colorectal cancer. Those are facts. And you have to, when you hear that, hopefully people take action on that. It's not just your age. It's not just early onset because you're young, but our backgrounds play a big role in that, regardless of what they are. So understanding that, asking those questions of your physician as well. Am I at higher risk because I'm this or that background? Those are important things. So I think I'd say that might be the most important thing for people to go and understand.
Excellent. Both very important messages. My last message will be, it's not a big deal. Just do it. It's not a big deal. Stop it. You
might even enjoy it.
You might even enjoy it. Who doesn't enjoy a good nap? That's for sure. All right. Well, Kurt and Brooks, thank you so much for joining us in the podcast.
Thanks so much, Tom.
Thank you, Tom.
Good to meet you.
Well, that is a wrap. Thanks so much for joining us on this episode of the Olympus Talks podcast. Thanks to Brooks Bell and Kurt Cannon for joining us. And of course, a big thank you to our corporate partner, Olympus, for helping to make this podcast series possible. In our next episode, you'll hear a great patient story and discussion about the prevalence of pancreatic cancer and the caretaking experience. For more episodes of Olympus Talks, please go to olympusamerica.com/podcasts. You can also subscribe to the Device Talks podcast network And you can follow us on LinkedIn. And while you're there, connect with myself, Tom Salemi, editorial director, and our managing editor, Kayleen Brown, who put this episode of Olympus Talks together. That's it, folks. Really appreciate having you here on the Olympus Talks podcast. Tune in to our next episode for another great MedTech story. Take care, everybody. The EVIS X1 endoscopy system is not designed for cardiac applications. Using other combinations of equipment may cause ventricular fibrillation or seriously affect the cardiac function of the patient. Improper use of endoscopes may result in patient injury, infection, bleeding, and/or perforation. Complete indications, contraindications, warnings, and cautions are available in the instructions for use.